Hello, everyone. This is Steve Adams here with Dr. Matthew McNamee. Uh, Dr. Matt is our Chief Clinical Officer at Tiger Medical Institute, which is also strongly affiliated with Tiger Performance Institute. And we're excited to be here today to talk to our group where you exclusively get this content. And today what we're going to talk about is if you have a family history of dementia or memory loss or Alzheimer's or some other cognitive disease, we want to talk about that today and have Dr. Matt weigh in on that. Dr. Matt is going through a very high level certification program called Pre-Code. So he is gaining clinical expertise in this area that all of our patients at Tiger Medical benefit from. Dr. Matt, how are you doing today?
I'm doing excellent, Steve. How about you?
Good, good. You got sunshine in Seattle today, which is a rarity. So he's smiling even more.
Hang on to it.
So Matt, here's the first question. If someone has a parent or a grandparent, and you tell me if there's longer trees than that, who has suffered from memory loss, dementia, Alzheimer's, or maybe some other neurodegenerative disease, does this potentially put them at greater risk themselves?
Sure. So I think the key factor is, short answer is yes. Mm-hmm. But the key element is it has to be a first degree relative. So a parent or a sibling, so like a brother or sister. If there is, one of those relatives in your family that does increase it's an increased risk. Does not tell you you're going to get it. If you have more than one, it will even increase your risk a little bit more. But it's only a part of the equation, essentially.
Right, because there are other risk factors from lifestyle, right?
Correct. And there's a lot of people that have first degree relatives that will never develop any form of dementia. So
what about people that don't have any first degree relatives with any kind of neurodegenerative disease, but what kind of lifestyle would lead to them having the same risk as if they did have first degree relatives who had one of those diseases?
Right. So one of the biggest risk factors for dementia related, diseases and Alzheimer's specifically is obesity. That's a big risk factor. High blood pressure, blood sugar problems, so things like diabetes, prediabetes and such, inflammatory conditions.
So a lot of internal systemic inflammation.
Correct. I mean, they've tied chronic inflammation and everything from, Alzheimer's disease to diabetes to cardiovascular disease to cancers, almost any chronic condition has been tied into inflammation. And this is one of them.
Sleep's another one, right?
And then age is a big risk factor, so just aging in itself will increase your risk. So we want to start, kind of getting an assessment with people to see where they're at and start screening around age 45, because over 45, your risk starts to go a little bit.
So that's a good segue into my next question. What testing is available that you can use? And I realize you're not done with the Bredesen program just yet, but when you're done with that, what clinical tools will you have to assess cognitive disease risk, as well as, you've got some things you do now also. So just kind of expand on that.
Sure. I mean, well, they overlap. So the evidence behind all of these, multiple drivers. So, I mean, the cognitive decline in itself is there are so many different factors that play into drive, basically, essentially that will drive the process. In fact, they've got at least 36 and change that are part of that essentially kind of overall assessment equation. And some of those are looking at blood sugar levels. The higher the blood sugar levels, with insulin resistance on top of it, is a great recipe for cognitive
Yep.
decline.
Yep.
Nutrient markers that are off, deficiencies, hormones that are insufficient as well, that will play a role in this. The health of the gastrointestinal tract, the microbiome, the whole health of the gastrointestinal lining and that barrier that's supposed to keep things
The army.
and allow things correct, not basically to allow nutrients to be absorbed, to keep all the other toxins and pathogens and stuff out. That plays a role. And these are all things that I already currently look at.
Mm-hmm.
Inflammatory markers, so looking at see if there's markers for inflammation, and then finding out where those markers are coming from, so we can address those.
Right.
Those are
What
ones.
about genetics? Don't you have some ways through genetic testing also to know if there's elevated risk?
Sure. I mean, the one gene that has it's a risk, basically a risk gene, that has the highest correlation to your risks, your overall risks for developing dementia, and specifically Alzheimer's, is an ApoE gene.
Mm-hmm.
And we get one copy from each parent, and basically, if anyone has a copy of the ApoE4 gene, they have a ballpark about a 30% increase risk. If you carry two copies, which is very rare, your risk goes up over 50%. And then if you do not carry any of the copies, which is about ballpark, I think about 2/3 of the population, your overall risk is still at about 9%. So,
right. And what I just heard though is there's 36 different pathways that could potentially lead to Alzheimer's. That's what you were describing earlier. So even if you're at the 9%, but you have a lot of negative correlation in those 36 pathways, if you have a lot going wrong in your life there, you could be at just as high a risk as someone with two copies from each parent, and they are living a super healthy life, right?
yeah, potentially. I mean,
Mhm.
that's kind of a good way of looking at it. I mean, the analogy that's been used is that if you've got like 36 holes in the roof and the rain's getting in,
Yeah.
you can't just plug 2 or 3 or 4 or 5 of them in order to get the rain to stop from coming in. And you have to address all those holes, plug all the holes, to essentially prevent and or reverse that cognitive decline, which would be the
Yep.
right.
So what I'm hearing is from you is that you could be at high risk one of two ways. One would be just from first degree relatives, parent or sibling, who's had a cognitive disease. So that will elevate your risk. But also, you could not have any of that, but you could have 10 or 12 holes in your roof, like you just said, and that would also put you at risk. The worst case scenario is you have both. And so, but the good news is there are tools that you have at your disposal that you're already using right now that tell you if someone is going down that pathway. So what is the payoff if somebody invests in learning how many holes they have in their roof, if you will, to carry on the analogy further? What's the payoff to them? Like what can you do as a clinician if you're working with them and you get them relatively early?
Well, it's massive, and it's basically kind of simplified in this aspect of the pre-symptomatic component of cognitive decline and Alzheimer's and such is a pathophysiology, a disease process that starts 1 to 2 decades before any symptoms start. So
Yep.
we can test, we can see, and catch this earlier and start treating before symptoms start. So there's already abnormalities occurring within the brain and the body. Yep. Well before symptoms start. So we can catch them earlier, get ahead of the game, and ideally prevent this from even occurring. So that's
right.
That's the
well, and I know from what we do, you scan the brain. We look at all of those markers that make up the 36 holes in the roof analogy. We look at genetics. So you're really getting a pretty complete picture when people work with you to be able to address these. And so the real message from this video today is the earlier that you deal with this and know the current state of where you are from a cognitive health standpoint, the better chance you have of preventing long-term problems in your 70s and 80s is what you're saying.
Absolutely. Yep. 100%.
Yeah. Yeah. So that's good news for people. I mean, it used to be a death sentence. It no longer is. Say real quick what you're doing with Dr. Bredesen. Tell them about that training and certification you're finishing up sometime in the next few months.
Just in a nutshell, Dr. Dale Bredesen has been doing research for about 3 decades or so in neurodegenerative diseases, and specifically had been working with Alzheimer's disease and trying to target a specific pathway that he'd come up with a drug to essentially eradicate the disease. And through the decades of research, he found that there were multiple pathways involved, and that there isn't a single drug. There have to be, probably dozens of drugs that would have to target all these different holes, right?
Right.
So he created a program because lifestyle plays a role as well. And he created a program that he's been able to take people that have either had Alzheimer's disease and reverse it. But my specific interest is he created another program called PRECO, which is prevention. So we can catch these things essentially in advance. So through the comprehensive screening methods that we use, we're able to formulate a personalized plan, coupled with lifestyle suggestions and everything off the labs and imaging if it's indicated, and just create a personalized plan for them to ideally prevent and to optimize their health at the same time.
Yeah. Wow. That's exciting. It's exciting. And it's fun because I know we have several patients that you've been able to help. And listen, if you're listening in today, or you listen to this later, the biggest thing that I think you need to take away from this is that it's not just if you have a parent or a sibling that has had one of these diseases. Don't think just because you don't have any of that you aren't at risk. You potentially could be at risk and you don't realize it. So if you want to learn more about how to identify these risks and do something about it, just raise your hand, give a thumbs up, say I'm interested, and we'll get into a direct message with you and we'll explain more to you and we can take it from there. So Dr. Matt, thank you again for sharing your knowledge with our group, and have a great rest of the week.
You too, Steve. Thanks.